Before I get into this, I just want to say I'm not a medical professional. I'm not a doctor. If you choose to use any substances, make sure it's under the care of a doctor and you are getting regular blood work done. Now, that being said, let's get into the video.
Can I try another go? It's my turn.
Oh no, not there!
Okay, you two go on.
Guys, please get back.
Are you ready?
Be really careful.
That's good.
I'm aware.
I hate these like tiny needles. It takes forever to
Be careful, Mom.
inject it.
No, thank you.
What's going on, YouTubers? Thank you for being here. I just wanted to make a video talking about a little bit of a controversial topic today, and that is testosterone replacement therapy, or TRT. Now, there's a lot of stigma that goes with this, especially in bodybuilding, with natty or not, use of PEDs, all that kind of stuff. So what I'm talking about is having low testosterone levels, seeing a doctor, getting a prescription for testosterone, and injecting it. Anyone who's unfamiliar with my journey, last March, so it's almost been exactly a year ago, I was diagnosed with leukemia, had about 4 or 5 rounds of chemo, whatever it was, and then had a bone marrow transplant in August. So now we're about 6 months post-transplant. My endocrine system is a mess, and I'm not producing a lot of testosterone right now. As one can guess, going through that much of a traumatic experience, my body's a little bit messed up. But before I was diagnosed, I was on TRT. Years prior, I had tested my test levels, and they were low. I got put on TRT, slowly increased the dose a little bit, but I really felt best and did my best at about 200 milligrams a week. Yesterday at my doctor's appointment, they did a testosterone test the week prior. They only checked the free range. Usually they check the whole amount, but basically for an adult male like my age, a normal testosterone range for free testosterone is 47 to 249, I believe. Mine was at 44, so it was just under the lowest normal amount. Doctors prescribed me to get back on TRT, and we are starting out at 100 milligrams a week. So I did my first injection yesterday, and I just really wanted to document my journey. I want to show you guys where I'm at right now and how much 100 milligrams can do for your body. Okay, so here's my starting point. Been cutting down a little bit over the last couple weeks, couple months. Built a lot of muscle back from being sick. So I'm curious to see, here, let's see if we can do this. Curious to see what everything will look like in the coming weeks and months. And my weight right now is 219 pounds. So there's a lot of misconceptions. A lot of people think you need a ton of testosterone to make a ton of muscle, which I guess if you want to make a ton of muscle, you do need a lot of different PEDs and stuff. But I'm just going to show where I'm at, and I'll document the journey. So like I said, going with this, there's a bad stigma. I'm sure I'll get a lot of hate for sharing this journey and for telling people, but I wanted to be transparent and show you guys that, one, if your testosterone levels are clinically low, you should get some kind of treatment or try and do something to improve it, because it makes your quality of life 1,000 times better. And second, just dispel all the myths that you need a lot of gear or steroids or PEDs or testosterone to look great and to be great. A lot of people think you need, a gram of testosterone a week, when really, we talk a lot about in exercise about the minimum effective dose, and there's no difference here. But along with that, in my experience anyway, in the years prior that I had been on it, you do get a lot of misconceptions, even in the medical community. So I've been to several doctors throughout this, and I've had a lot just blatantly accuse me of lying, saying I'm taking more, telling me that I'm, stacking with other things. They keep trying to press me like, what else are you taking? What else are you taking? I'm like, bro, I'm just taking 200 milligrams of test a week. My body does well with it. And a lot of people think that you just keep injecting a ton of stuff that you'll get really big, but a lot of it has to do with your androgen receptor density. So that comes with like genetics, and you can build more with, exercise, diet and sleep, that kind of stuff. But really a lot of your ability to uptake depends on your genetics. So I've done well with a lower dose. Some people don't respond like that, but it really just depends on you and the way you feel. So I'm going to do my best to document this. So make sure you follow, subscribe to my channel, follow me on Instagram, Lawless Fitness, as well as TikTok, also Lawless Fitness. And I'll be posting more about my fitness stuff on there and my journey. So stay tuned, and I appreciate you guys for watching.